Good day. My name is Ángela Suárez, and I am delighted to present on behalf of the AMORE project our Driving Towards Equity proposal and its prototype in Cali, Colombia. For people in cities with traffic congestion like Cali, commuting times become more important than distance, and hours with smoother traffic flow, which are both cheaper and faster, can become infrequent. This situation is all too familiar to Margarita Gomez, a resident of the outlying areas of Cali. For 6 days every week, she walks either the 4 blocks between her house and the nearest paved road, where a taxi meets her to commute to her hemodialysis or chemotherapy sessions. Margarita is just one among the many, many people who suffer from the direct and hidden costs associated with regular travel to receive ambulatory care. For some, the delays caused by traffic congestion can be critical when every minute matters. Traffic congestion reduces accessibility and diminishes the overall quality of care. Despite the widespread impact of this issue, there is a lack of data concerning accessibility to health services that considers traffic congestion, let alone with an equity perspective. The accurate and affordable measurement of accessibility has proven to be challenging for cities facing traffic congestion. Measurements often relied on either average travel times or travel distances. However, fixed estimates become misleading as traffic congestion worsens. Comparing a 2017 study with a dynamic 2020 assessment, the latter shows that urban accessibility to tertiary care emergency services drops from 84% during free flow traffic to 38% for most of the day hours. This reveals a previously overlooked problem. Studies are often developed by uniform teams of specialists with minimal input from stakeholders. They present their fixed findings using complex indicators, formulas, and graphs, making them difficult for non-specialists to comprehend or to test assumptions. They're also cumbersome to update, limiting monitoring and planning. Driving Towards Equity is an extension of the AMORE Collaborative Project that delivers dynamic accessibility measurements to facilitate data-driven health services planning. This project has 36 stakeholders from diverse sectors and backgrounds who bring the views from authorities, scientists, urban and health services planners, service providers, community, and patients. They actively contributed to the conceptualization, design, implementation, and reporting of the web-based prototypes. The team advocates travel time metrics that consider traffic congestion and share these metrics in an interactive platform with cartography and descriptive statistics. For example, this map displays population sizes using column height. It's evident that the travel times to hemodialysis services in Cali are long for residents in the city's outlying neighborhoods, where most residents live. The openly accessible platform combined travel times, service locations, and population data with sociodemographic information for each traffic zone analyzed. We tested the prototypes and identified the ideal location for new services to optimize accessibility. And the data speaks for itself. It allows interaction to draw meaningful conclusions. New services here would allow 900 additional hemodialysis patients to be within a 20-minute commute. We can determine accessibility gradients by sociodemographic characteristics like economic stratum. Our findings confirmed that residents in Cali's outlying areas, like Margarita, invest disproportionately to access these services, which can push their families into poverty. We offer competitive advantages, such as an updatable platform to support planning and monitoring, the option to integrate other services, modes of transportation, and be used in many other metropolitan areas, And the entire process was developed with users and centered on their needs. With your support, Driving Towards Equity will generate scalable knowledge and inform local policy debates. With our partners and local stakeholders, this model and equity perspective can be replicated in other busy cities around the globe, and dynamic accessibility metrics will be implemented. We will update measurements, expand public transport network assessments, and provide demand estimates for new services in existing or new infrastructure, and beyond the tested services. With enhanced accessibility assessments, health equity, and universal health can be promoted and stakeholders empowered to act with solutions for people like Margarita Gomez. We're ready to address your comments and questions and share with you our vision for this people-centered innovation.